Beryl Leach. I'm the head of policy policy advocacy and communication at 3IE. And it's my pleasure to welcome you to the next session, where we have a panel of contributors who are going to help us start a conversation. And that conversation is one that we have a lot in 3IE. And Charlotte really provided a great introduction because she was talking about what it's taking in primary studies, including impact evaluations, to improve the uptake and use of research evidence. And we know a lot, and there's been a lot been done. ODI, the RAPID team, has been contributing a lot. DFID-funded RPCs have been contributing a lot to what we know about making sure that research is relevant and likely to be used. Where we know less is around the challenges that we face in using and promoting the use of synthesized evidence. So the basic focus of this session is to be able to hear how people who are working in this area are taking on the challenge of promoting the use of synthesized evidence. What's working, what are the challenges. But I know that a lot of you out here are also expert in your own way or have faced these challenges yourself. And so we're trying to construct this session in a way that after sort of tasters of experiences, that we'll be able to bring the audience in. Now, one way to get that started is by making sure that before we start with what we know, that we can hear from anyone who wants to pitch in and say, you know, I'm sitting through this session and not checking my phone because I really want to know how you do X, or I had this terrible experience and I want to share it. Or even if you don't take too much time to tell us about what you're doing, okay? But in the initial phase, what I'd really like to help us get a sense of here in the front is what's on your mind for this session. So we've got 2 mics. I'm going to give it 2 or 3 minutes, so be quick, and I will try to jot down some basic reminder notes here on the flip chart so that we can refer to them as we go along. So if anybody's close by me, I'm happy to share my mic if you have a question or a quick comment for us.
Director at 3IE, I'm the head of the Washington office, and my question arises from the years I worked for USAID. And my question has to do with the challenge of getting funding to support this type of activity. So you get funding from USAID, for example, you can do research. And there are other mechanisms for implementers to use evidence, right? But it's very difficult to incorporate into scopes of work, whether you're doing a systematic review or you're doing use of evidence in communications. They tend to be different funding streams. So how can we promote getting both in both?
Then a challenge for funders really to better integrate the funding streams and what's being done. That sounds like a natural definitive question. So you're warned. Okay, anyone else? Okay, all right. So I'm going to get on with the introductions and hearing from our contributors. I'm going to start with Kerry Albright. Kerry leads and coordinates the research facilitation and knowledge management activities at the UNICEF Office of Research in Innocenti, which for those of you who know, I am one of those who's jealous about where you get to live and work. Okay? Florence, Italy, I wish you had a bigger team and more job opportunities. This includes oversight of research and knowledge products, commissioning of systematic reviews, evidence briefs, and research scans, advising on development of research outreach and uptake strategies. She contributes to governance of the research function in UNICEF globally, the identification of knowledge gaps, improved use of research and evidence in policy and program design, and capturing research impact. And in the interest of full disclosure, she has worked at DFID.
Thanks, Beryl. Beryl stole my thunder because I was going to open up with asking how many of you actually even knew that UNICEF had an Office of Research. Because I bet the answer is probably pretty small. But actually, I mean, we take evidence pretty seriously in UNICEF. We spend roughly $120 million a year on research alone, a lot more if you add in evaluation and data analysis and collection. And the way that we view evidence at UNICEF is, I guess, across three functions. So we look at it as research, evaluation, and data collection and analysis, with a sort of cross-cutting lesson learning and knowledge management function as well. We have about 170 offices worldwide, and there are evidence specialists of different types within those. And probably about 90% of the research spent is spent in the field. So it's highly decentralized as a context. So given that background, I think you probably might think that actually, what's the problem? Evidence specialists, offices all over the world, surely things are very rosy for you. But Beryl asked me to talk a little bit about our experiences in using evidence generally to start with in terms of informing decision making. And actually traditionally I think there's been very few formal requirements to use evidence, and we've been guilty of very much relying on tacit knowledge, experience, the interest of the particular country representative in terms of using evidence in decision making, and the willingness of individuals to actually seek out sources of evidence, with the exception perhaps of evaluation, which is quite a formal thing within UNICEF and reports directly to the board. And I think also UNICEF maybe has always been seen more as a sort of doer, very much a kind of service delivery, saving children's lives rather than a thinking organisation. But actually we're looking to change that. Especially I think since in the SDG era, more and more governments are able to deliver services themselves. And so we're looking to sort of reposition ourselves as a sort of knowledge broker or an evidence broker for children. And evidence is seen as a key driver of change in our new strategic plan. So we're actually looking to take it a lot more seriously. We previously partnered with 3IE on sort of trying to instigate interest in impact evaluation across UNICEF, and now we're also at the moment partnering with Campbell to produce a mega map, an evidence gap map of child welfare interventions mapped against the key 5 goals and 16 results areas of our new strategic plan. So I think you can see maybe that the interest in evidence is becoming more institutionalized. But I mean, when I'm thinking about, is there a distinction between systematic review evidence and other types of evidence in decision making? Honestly, there hasn't been a huge distinction across UNICEF. I think we started with quite a low baseline of actually getting people to think evidence at all, let alone the added value of synthesized evidence. And I mean, I guess thinking about the advantages and disadvantages of synthesized evidence, the advantages for staff generally across UNICEF, that if we've got it right, the evidence is immediately available. It can help feed into decision making and quick turnaround. But that does depend upon people who are producing the synthesis to have a really good sort of eye on the horizon scanning and know what sorts of questions are likely to be coming up in future. For those of us who work more in evidence functions, I guess, there are kind of more broader ideals that we would want to ascribe to. So you're trying to minimize staff cherry-picking certain sources of evidence, only going to favored professors from previous studies or previous people they've worked with. Also, the value for us in terms of getting new insights from the body of knowledge rather than from single studies, and obviously avoid reinventing the wheel and helping to identify gaps. But the disadvantages are also equally well known, I think. For most staff, a lot of forms of synthesized evidence like systematic reviews or gap maps they don't match the timeframes. They take too long. People need questions answered pretty much straight away. They're looking far more for sort of rapid evidence assessments or rapid reviews than things which you might not get an answer for sort of 9 months, a year. And they're expensive. So there are questions there about the relative worth of that investment. And also equity issues. I mean, I think a lot of people in UNICEF have a social science background. No surprise probably to this audience, but there are concerns around the reductionism of, reductionist nature of many synthesis products. The ideas about sort of whose voices count or whose voices are missing in these sorts of products. And then the usual sorts of concerns about the international peer review system anyway, in terms of not many developing country authors getting the same sorts of level of exposure as international researchers, non-English studies, bias against replication studies, all of those sorts of things as well. So I think it's sometimes easy to dismiss as being prejudiced or being seen to be prejudiced against certain sources of evidence. And then I think there are very practical challenges in some areas of social science. So we tried to commission a systematic review on gender socialization earlier last year, looking at the sort of the roles that parents give to their kids unconsciously in early childhood and how that affects the way that society expects people to behave. And there just wasn't enough documented evidence out there. So there are some questions, I think, that maybe it's just very hard to find that sort of evidence, and the synthesis methods aren't necessarily the most appropriate. Beryl also asked me to think a little bit about quality, and do we find that decision makers or users really care as much about quality as perhaps we do here? And I have to say that, I mean, in this area, I think UNICEF research does quite well. We have a very strict sort of quality assurance process and procedure. And we see it as a really important part of our brand, so we take it quite seriously. And a lot of our regional offices have specialist agreements with external service providers to quality check the research that we produce, from thinking about terms of reference through to design and method, all the way through to the sorts of reports that we produce, etc. And similarly for evaluations, there's an independent quality assessment system called GIROS, which rates each of the evaluations that we produce for quality. And I think quality is actually a growing area of importance for us. When we've produced some of our systematic reviews or evidence gap maps so far, UNICEF staff have generally been quite horrified about how little UNICEF research actually makes the cut and gets featured in the final product. So I think that was a bit of a wake-up call. But I think that's a broader question, really, in terms of there's a difference between bad research and badly documented research. And so we've been trying through sort of training that we've been giving on critical appraisal skills and evidence synthesis, etc., to actually get people to recognise the value in being more transparent and actually documenting the design, the method, the thought process as they've been going along to help increase the chances that it would make the cut. But I think as a community, that's something that we need to think about more, how we encourage more transparency in decision in documenting.
She heads the IRC's Women's Protection and Empowerment Policy and Research. She's directing 2 consortia led by IRC looking at what works to prevent violence against women and girls in conflict and humanitarian contexts, and violence against adolescent girls. She's also worked with DFID, Womenkind Worldwide, and Concern Worldwide. So welcome, Mairie.
Yeah, that's great, thank you. Hi everyone. So I'm just, full disclosure, I'm definitely speaking from a kind of practitioner, activist point of view. And one of the reasons why I decided to join the International Rescue Committee was I was really impressed that there was a humanitarian organisation that had such a commitment to research. And that was one of the things that really interested me about the IRC. So I'm going to talk a little bit about how the IRC has invested in research in recent years, and in particular in a tool that we've developed called the Outcomes and Evidence Framework. This is a tool that we use throughout the International Rescue Committee, which highlights standardised outcomes that help us as an organisation be clear about the goals of our programming. And in this Outcomes and Evidence Framework, it also provides theories of change that represent our best understanding of the pathways that lead to each of the outcomes. Why I'm talking about this in this particular session is because as part of this framework, IRC has embedded evidence summaries within the theories of change. So so that people can see what evidence exists related to the pathways of change. The evidence reviews that we've done have mainly been systematic reviews of controlled trials. And the idea of including these summaries in this framework is to support practitioners to better understand what evidence exists to facilitate a conversation about programming decisions. One example of how we've used this evidence-based approach is around our investment that we make in child protection programming. We've moved recently from a community-centred child protection approach, where we've seen no evidence, despite it being widely practiced in humanitarian contexts, to looking more at family-based child protection techniques and interventions. Now, these weren't widely practiced in the humanitarian sector, but we saw through our work in the evidence review that this had a strong evidence base in high-income countries. This allowed us to adapt that programming for humanitarian contexts, pilot it, scale it up, and then do rigorous research on it. And recently we've seen really positive results from impact evaluations of these sorts of programs. So through this process of the outcomes and evidence framework, we've learned some really important lessons. It hasn't all been plain sailing, it's been quite painful at times. The first is that, I think a lot of people talk about how we need to simplify systematic reviews for practitioners. One of the things that we learned is that simple is not always best. When we put together the systematic reviews, we gave them a traffic light rating. Now, this was very intuitive for people to use, and they liked it, but we found that this was often misinterpreted. So, for example, people saw green as go, yes, definitely do that intervention, it's got really strong evidence, and red as don't even go anywhere near that because it has no evidence, whereas red could mean a myriad of things, including that there was no rigorous evidence available, rather than that the intervention didn't actually work. What we did for that was to change something really simple, but just to change the colour coding system. So we used purples and blues and other colours, which encouraged people to actually interrogate the data a little bit more and think about it a little bit more, rather than just making a quick decision based on that. The other thing that we've seen is it's been really helpful to use systematic reviews as a starting point. So not as the only piece of evidence that we use to make decisions, but as a way to start conversations and as a way to bring in other types of evidence to supplement that. And I can talk a little bit more about that later if it's interesting. The third is that systematic reviews, even coupled with things like theories of change, are just not enough for people to make decisions. And so what the IRC has done is invested in people to help support the organisation to use the tool and the evidence appropriately. So, for example, now the IRC has an evidence to action team, and their job is to work with us around the organisation to understand what we need to know, why we need to know it, and then support us to understand the evidence and work through the next steps of that. Now, the last point I make, to me, is most important, because as a practitioner as myself, and working mainly with practitioners and activists, I really understand the challenges of engaging with systematic reviews. Now, this list isn't exhaustive, but some of the things that we found are that you feel like there's not enough contextually relevant information. You don't have enough time to sift through it. People don't understand the terminology. Researchers and practitioners speak totally different languages. Practitioners don't understand the implications of the research. So, for example, what does this mean? What does this mean that I should be doing? And people not understanding how other factors, including context, research design, and issues with quality of programming can affect the results as well. And then finally, one of the areas that I've noticed in my area of interest around gender-based violence is issues of the definition of the intervention can also confuse things. So what makes it easier for us to use this type of evidence? And I think, I unfortunately wasn't here this morning, but I understand that Charlotte did touch on some of these issues earlier. And to me, it seems like a really simple solution. People often refer to it as blurring the lines between the suppliers of the evidence, so the researchers, and the demanders of the evidence, so practitioners and policymakers. what does that actually mean in practice? It just means engaging different people, different types of people in the research process. So, you know, activists, practitioners, thinking about what decision makers want, whether that's systematic reviews, impact evaluations, or other types of evidence generation. It's involving other people in making meaning. And this preferably needs to start right from the inception, so defining searches and reviewing and feeding into research, and then afterwards actually sitting in a room together, researchers and practitioners, interrogating the data, people being allowed to ask questions, and then moving on to a conversation that says, so what? What does this actually mean for what we want to do? In this way, people can be really clear also about what the data is and isn't telling them before going on to make a decision about programming. And we found that this really moves us from a place of just having the evidence to being in a position of learning, actually learning and making decisions from the evidence. As well as using this evidence internally, we also invest a lot in research uptake and in influencing other practitioners and policymakers. And I could talk about this more later, but honestly, I'd have to say my experience of how much people care about the quality of evidence definitely differs, and I'm really looking forward to hearing from David actually about that. But just to throw an example in the ring, my main experience of kind of using systematic reviews in, I suppose, advocacy and influencing policymakers is in the field of gender-based violence, where up until recently there was particularly in conflict and humanitarian crisis, there was a real dearth of rigorous information. And again, there's some really interesting reasons why that is the case, and happy to talk about that. But we found that actually using systematic reviews to advocate to donors about the lack of evidence was really, really helpful. So actually having the systematic reviews that said there is really limited rigorous evidence about the effectiveness of GBV interventions in humanitarian crises, made donors go away and think, well, yeah, actually, we should invest. And that's one of the ways that, one of the reasons why DFID invested I think £25 million around research into violence against women and girls. So that was really useful. That's it for me. Thanks.
Yeah, thanks. I'm going to step in here a little bit. I'm already hearing some interesting sort of threads, and I want, if we could have some quick reactions. Kerry had mentioned that there were some problems with how systematic review evidence is perceived. And also Mairie is bringing out that, and I think especially from the position of IRC and gender and equity responsive evidence, what's invisible, what's not being captured, and to the extent to which these are failures at the primary research level in terms of methods, to what extent is it a reporting failure, as Kerry said. And then I'd also like to just get reactions on, we learned in 3IE the hard way, sounds like it's being learned the hard way elsewhere, that because systematic reviews are so expensive, take a lot of time, that we developed mapping to be able to know before we spent all the money if the right kind of evidence was going to be there, so that we could go with a more rapidly done, sound, informative map to the donors and say, we can't tell you what we need and want to tell you, say around gender, socialization, harmful gender norms, because we've looked and it's just not there. So you do need to think about putting your money in there. So just any quick reactions on those, but those are just two things that chimed with me out of the first.
No, I mean, I think there are. I mean, the issue of timeliness, I think, is a real problem, both in terms of getting the results that we actually want, but also whether or not people see that there are other products perhaps that could bring the answers a lot more quickly. So I think 3IE's investment in a lot of the sort of looking at how we can improve the quality in rapid reviews is really important. Yeah, I mean, I think that's probably all I have to say on that.
Mairie, in terms of, given your specialty, and and having some colleagues in IRC bemoan the fact that the evidence that's there and have these great tools and processes, that it's not giving you the evidence you need to do a better job, within your programming. That if the vulnerable and marginalized populations are invisible, then how do you use your framework to give you more informed guidance?
Yeah. So I think you're spot on in that it's, for me, in my area of interest, women and girls do become invisible because the primary evaluation often doesn't disaggregate. But we also have seen that in synthesized reviews, and when we're looking at people who've done synthesized reviews, what you don't see is secondary outcomes from the primary evaluations, which hasn't been very helpful for us when we're looking at women and girls. So that's the first thing. The second thing is that I think the challenges, particularly around gender-based violence in conflict and humanitarian crises, and really happy to hear people's thoughts on this as well, is that where we've started putting together synthesized evidence based on control trials and really rigorous levels of evaluation. Now, in my field of work, there are just some interventions that don't lend themselves to that sort of evaluation, especially in humanitarian contexts. And I can definitely get into detail here, but one example is what we consider to be the cornerstone of some of our programming, which is around case management. How do you have a control group for case management when people need it? And we can't waitlist in that particular example. So that's also a challenge for us, and that's why I think for us using this framework has to be using the outcomes and evidence framework with the synthesized reviews has to be just the starting point. People need to understand that there isn't any evidence on case management, not necessarily because it doesn't work, but for those reasons. And start to think through other ways that we can develop the evidence around that, even if it's not an impact evaluation, to be able to say, right, okay, let's look at other ways we can look at whether this is working or not, and look at whether we can generate different sorts of evidence on it as well. So to me, it's making sure that impact evaluations and synthesized reviews of controlled trials aren't the only thing that you're looking at.
I think that's great, and I want if you want to comment on the challenge to DFID, and can't wait, we can have you comment now.
I can wait.
I see Ian Goldman at the back of the room, and I want to draw him in the sense that I'm wondering if he's hearing something that resonates especially, which is Marie's point that promoting evidence use is promoting a dialogue, that this is not just a one-off where you read the research on your own, that there's a process in IRC for having an ongoing conversation. I know that DPME in South Africa has been playing a leading role in promoting more of these ongoing relationships between researchers and breaking down that false bridge of you've got the producers on one side and you've got the users on the other, and you've got knowledge brokers somewhere at the top of the bridge somehow, that it is more iterative. So I would hope that he would be able to chime in at some point with some examples.
Yeah, I think the whole relationship, so our role is as a knowledge broker, so we've got to be dealing with the commissioning and trying to find where we can generate the evidence, but working with the policymakers on what the agenda is and how we can feed it into that. So we're constantly having to bridge that role and work with the policymakers around that, and the work that we do before the research or evaluation starts and the work we do after it finishes is as long as the doing of the actual research. So trying to make sure there's a common understanding of what people are trying to do, working on a theory of change for the intervention because usually it's not properly defined, trying to identify the questions and the type of work which will be undertaken takes a long time. But I want to throw back a question to Julia, I think, is it? From ISEAL, on the evidence to action team and how that works. works, because I think I'd be interested to hear more.
Because I think that we'll get through, because coming back to more of a description of the evidence team, that IRC is its own kind of few minutes. And I saw Vidya nodding her head, really resonating with some of the things, so I don't want to make you wait any longer. So Vidya is the manager for ISEAL's Impacts program, and she will explain ISEAL's. I'm not going to try to. So that she leads ISEAL's engagement with the research community to promote and learn from credible, relevant external research on the impacts and effectiveness of sustainability standards and communicate such research effectively. She also leads on internal evaluations as part of ISEAL's own organizational M&E. ISEAL is a very engaged stakeholder. I'm reading a note to myself. That I would point out that one of the reasons that we're aware of ISEAL's work is because 3IE funded a systematic review on agricultural certification and impacts on farmer producers and workers. And we think that we all benefited a lot by the way the research team engaged with key players like ISEAL in the production of that systematic review and helped build understanding and demand for it. And we're happy to say that it's good that post-systematic review, by doing our work a bit differently, that we now have these relationships with users much more directly and an ongoing dialogue. So without further ado, you have your microphone.
I do.
Welcome.
Thanks, Beryl, and hi, everyone. So a quick line or two about ISEAL. We're probably quite new to your world. We are the global membership organization for sustainability standards, which is a whole lot of words. Effectively, if you've heard of schemes like Fair Trade or the Marine Stewardship Council or Forest Stewardship Council, these group of standards effectively are called sustainability standards, and we're the global membership organization for about 22 such leading global standards. This puts us in a very interesting position with regard to evidence and research. So we as ISEAL do not ourselves conduct interventions, our members do. But we, as the membership organization, have an interest in making sure that they are monitoring their effects and investing and evaluating their impacts, but also because we sit at that crux between our members and the world of stakeholders out there, whether that's the business community, the policy-making community. We are also very much a knowledge broker. Part of our job is to keep the pressure on our members to do good monitoring and evaluation. We do research ourselves, and I'll talk a little bit about why synthesized evidence matters to us, sitting at that meta level. And also then our challenge is how to translate what we're learning and translate what our members are doing into action that we demand from some of the stakeholder groups we work with. So that's a little bit of the world that ISEAL inhabits. I mean, in terms of the first question of why evidence matters, to us it matters for three chief reasons. One is, as the membership organization that is interested in this particular development approach, which is the use of voluntary sustainability standards, we're obviously interested in evidence that has strong learning potential and system innovation potential. So questions around how does the model need to innovate? Does the model work? This is particularly interesting for us because as development interventions go, sustainability standards are very new. They've roughly been around for about 15, 20 years, which means that in terms of the length of the intervention, you don't have that long a period of time as you might have had in the field of medicine or health or education. So learning and system innovation is one important desire of ours on why we're interested in evidence. The second is plain and simply accountability, which I think runs across all of our organizations. Accountability to users, so people who put money into using these standards. So if you're an M&S and if you source certified coffee and stack that on your shelves, you're interested in knowing what your money is doing and whether your investment in a certain scheme like Fair Trade is actually delivering the results. So there's value for money level accountability, and there's accountability to funders, donors, and governments who actually support standards. So you could be the the federal government of Germany, who actually says that all palm oil that's used in the German territory should be certified to the responsible sustainable palm oil standard. That's a government supporting a sustainability standard system and therefore interested in knowing whether that system works. The third is uptake and outreach. We're also interested in seeing if there is we're interested in seeing if sustainability standards can scale up. One of our areas of work is promoting our members to enter emerging markets. So Brazil, India, China, Indonesia, what potential do these tools have there? So there is a lot of value in investing in evidence and research in our field. In terms of synthesized evidence, this is relatively new, and I'd really like to stress the point of timing that has already come up in this panel. Because sustainability standards are a relatively new development intervention, we often ask ourselves whether synthesized evidence is the right thing to do with monitoring and evaluation resources at this point in time. When 3IE commissioned SOAS to do the systematic review that Beryl just mentioned, it was great news for us because actually, in some ways, we were nervous about how much empirical literature actually existed in the field to do justice to a systematic review. But what we did know would come up would be the knowledge gaps and the evidence gaps. And that's proved to be really useful as well. So even if you're a relatively new development intervention, I think there is value in doing systematic reviews because it can really pull out knowledge gaps, intervention gaps, which systems are being targeted by researchers more than others, which products are research biased towards. So sustainability standards touch about 50, 60 products, but 90% of the research focuses on coffee and cocoa, right? So what potential is there to do that? I think the other thing with synthesized evidence is that sometimes in our world, there is really the need to focus on the forest and ask questions at that level. Questions about the effectiveness of the model, the effectiveness of the system. Questions that are not context specific, but need to draw from the context specific realities and then give the reader a sense of the effectiveness of the intervention at that level. Just to give you all an example, let's take a sector like coffee. You have at least 4 or 5 sustainability standard schemes that are active in the coffee sector. Coffee grows in 50 plus countries of the world, and there's obviously variations in how these schemes operate and create impact if they do. In a country like Indonesia versus Nicaragua versus Kenya, and so on. Each single impact evaluation has a lot of value for the supply chains and for the actors and for the smallholder communities who work in those countries. But if you're a company sitting in the Netherlands, or a retail chain sitting in the Netherlands, or if you're DFID, who actually fund a lot of these schemes, you're not interested in the differences in each of these countries. You're interested in the level of knowing, does certification work in the coffee sector to improve smallholder farmers? If it says it works in Indonesia and it doesn't work in Kenya, why is that? Synthesized evidence helps make sense of contradictory findings to some extent, and also helps, I think, overcome this very frustrating thing that I hear from users saying, don't just come back to us and say context matters. We know context matters. What can you say beyond that about what works with these interventions? I think the third role that synthesized evidence plays, and this is much more for us at ISEAL, is the comparative value of comparing tools and approaches like standards with other market-based tools. So we're at a time right now where, let's take a topic like deforestation. Deforestation is globally a very hot topic right now. And sustainability standards are one set of tools that could address issues like deforestation. But they're not the only one. You have large companies making commitments, so there's corporate commitments, there's reporting, there's probably national level platforms that organizations like UNDP invest in. So the point is that if you want to compare the relative efficacy of an entire approach with another approach, that's much better done through a systematic review method rather than independent impact evaluations. Coming now to challenges. One of the biggest challenges I think we face when it comes to systematic reviews is communication. Despite our best efforts, and I think the 3IE systematic reviews are really great exemplars in this field of plain language English summaries and so on. Despite our best efforts, people find systematic reviews really dry. They can't relate to the content. There's nothing tangible in there that says, okay, this is why this matters to you. There's a real effort to translate what's emerging as key insights, key knowledge, and connect that with specific user groups. One of the questions you wanted us to reflect on, Beryl, is how we're using evidence to inform decision making. And I feel quite strongly about this because what I've been hearing is that, of course, it depends, and we all have work to do in making evidence matter. But I don't think decision makers are all sit in one bucket. If we want to get serious about using evidence for decision making, we really have to focus on audience segmentation and understanding what our key audiences want and what critical actions and decisions we want from them. So for us, for instance, at ISEAL, we work with the business community, we work with the policy-making community like governments, we work with donors and funders, and then there's other actors, the smallholders themselves, the certified entities themselves. We don't want the same decision from all of them. So if you commission a systematic review and you're interested in driving critical actions, it's really important to understand how to carve and shape your insight into a manner that it instigates or inspires that critical action from that group. So we're putting a lot of effort now into audience segmentation and understanding how that can be the bridge and uncover this black box really of how we use evidence to inform policy making. I think the last challenge on quality, this has already been said. I think it really depends on the user group. If you go and speak to businesses, they will always tell you, of course we want really robust evidence, there's no question about it. But will it really matter to them whether you've used a counterfactual? Will it really matter to them whether it's an RCT or quasi-experimental? Not really. They really want to know that it's there. So investing in it is important, but it's not what they're going to read and it's not what they're going to use. Whereas if you look at others, such as intergovernmental organizations and other accountability actors, to whom accountability needs to be sort of given, I think they're far more interested in research. It probably take more time to read something that you've produced. So quality, I think, is something that this group decides. What standards do we set for ourselves as a group of researchers and evaluators? I don't think the quality question can be answered from the user community as readily. Who wants bad quality research? I mean, ask any user. They're not really going to say, okay, if you're giving me a choice, I'm going to take bad quality research. So I think it's a bit of a non-question in that regard. I think quality matters. The question much more is value for money. Is this the right time in the history of an intervention to do a systematic review? How is it being used to actually trigger key actions? And how are you thinking in advance of how that's going to happen? And really ensuring the value for money. I think lastly, my last point is that having said all that I've said, I think where we're getting to in sustainability standards is it's far more important for us at this stage as a community to look at evidence systematization as a step before evidence synthesis. So what are the ways in which we can organize evidence that we already have available? Whether it's case studies, whether it's impact evaluations, whether it's RCTs, evidence gap maps being a great way of doing that, but I think there's a need to expand the methodology of EGMs really, so that you do know at what points in time key questions can be answered by systematic reviews. So is this the right point in time to answer a question such as, what is the effectiveness of sustainability standards in delivering conservation outcomes? It's a question a lot of people are asking. We're under pressure to commission systematic reviews, but I'm not sure there's enough good quality empirical evidence out there to do justice to spend 100,000 euros on something like that. So if I am able to systematize the evidence and actually take it to donors and say, we have to invest now in empirical evidence, primary evidence, and encourage people to do that, maybe 5 years down the line, the systematic review becomes valuable.
Excellent, thank you. Kerry, you were jotting down some things that you're quick reactions.
I think in terms of the point about audience segmentation, I think about it the same way also from the point that Ian was making. I think, and I'm sure Nathaniel will make the same point, I think obviously we want quality evidence, but I think we actually have to recognize that even if the evidence is the best scientific quality, if you don't really understand the context, if you don't really understand the values of decision makers, the networks, the links, if you don't build critical appraisal skills or the ability of potential users to understand and to be able to interrogate the evidence, then you're pushing constantly without actually having a receptive demand base. So yeah, that's what I was nodding from.
Yeah, thank you very much. I find that it's incredibly revealing. Let me tell you, my name is Arian. I used to work in the public sector with donors, etc. Now I work with a cocoa producer in DRC in North Kivu. Now, I've sent this systematic review out to the people who own the company. Just context, there's 30,000 farmers in an extremely conflict-ridden area. Cocoa has had the most amazing effect on farmers' lives, 200,000 people. Now, there's evidence there. What I want to know is who's going to help us gather that evidence. We would facilitate this all. I can show the systematic review to somebody. So what? Can we go back to UTS, who've now then merged with Rainforest Alliance? The whole company has to change. Do they go back and say, look, on page 7 it says here, and you're not doing this? So there's an incredibly weak position here. It's an extremely unequal partnership there. So when we're talking about all these issues at the higher level, coming back to base level, right feet on the ground, stuck in Virunga Forest and round about that area there, we may circulate these results, but what can we do and how can we connect better so that this evidence then helps us drive the process or at least have a voice that's heard?
Do you want to go ahead and have a whack at that?
Yes, I completely agree at some level. And thank you for that. One of the points I was going to make is that I think the other thing we can get better at doing is connecting the value of approaches like synthesized evidence with primary monitoring and evaluation, which is what the gentleman is referring to. Now, primary monitoring and evaluation or performance monitoring is something we all do in our programs, whether that's a development intervention where you set up procedures for gathering baseline data, or whether what we do at ISEAL, which is force our members to have a theory of change, know your causal pathways, have your tools in place to gather regular data, and so on. If the two are not connected, you will have a problem like we face now, which is a grand, fantastic systematic review that I think in its entirety, probably 450 pages, probably Hugh and a few of us in the room have read. The summary, probably 50 people have read, and the 2-pager probably is what people will read. Now, and the value really is that there's a lot of good intervention that's going on where we're struggling to find money to put into primary level performance monitoring and evaluation. So I think there's 2 challenges. One is one of method and synthesis across our levels of research, I think, from synthesized evidence to primary M&E, and also how and where do we find the resources to actually invest in primary M&E, which is not cheap either. We say systematic reviews are...
Can I just add, it's done. Every farmer is visited every year. There's a 2-page questionnaire to satisfy which requirements. That data has now been digitized. That's a big problem for producers. But the evidence is there. Maybe the wrong questions have been asked, or we're not being intelligent enough in some of the things. But we could get that evidence there. It's what you do with it once you've got it all. So it exists there. Anybody in this room interested, talk to me, please. Because we'd love to get this back into the system, feeding into systematic evidence.
So Nathaniel Bevan works at DFID, and he heads up the Evidence Action Team, which is responsible for increasing the use of evidence by decision makers within DFID, but also in the wider world. The team supports DFID staff to commission, communicate, and use evidence and manage programs that support evidence-informed decision-making. And welcome, and I hope that there's still, when I'm last, I'm like, oh, they said this, they said that, what am I going to say now? So I hope we haven't put you in that dilemma, but maybe giving you some new things also that you can respond to. So welcome.
Thank you very much, Val. So my name is Nathaniel Bevan. I work at the Department for International Development. Just to set the context a bit, so DFID does spend a lot of money on research. A lot of that is a kind of global public good primary research. A lot of it is seen as a international development intervention in its own right, so it isn't necessarily for DFID policy makers and program staff. It might be about developing new drugs and vaccines and ways of delivering those, for example. But we also do fund systematic reviews, and we see those as a global public good as well. I'm going to talk though mostly about what we try and do in DFID to improve how our staff use evidence to make decisions. And I'll try and kind of build in what kind of some of the questions that people have asked and comments that have been made. Just a bit of context about DFID. So in 2013 we did an evidence survey. We asked a random sample of our staff some questions about evidence, and overwhelmingly the majority of staff, I think it was around 80% of staff, said that they value evidence, they love it, this is great, but that their managers don't. Now, given that there's quite a high proportion of the sample have managers in, you can see the inherent tension there. So the context of that matters, because it's not that people don't love evidence, or they don't say they love evidence, but there's other barriers, as others have talked about why that doesn't get used. So, promoting systematic review. So I don't promote systematic reviews. I suppose that would be my, don't hit me, Howard. I'll qualify that, but I think as others have kind of alluded to, but I'll say this more strongly, and I'm saying it as much to myself as to you, but we have to move away from products and thinking about products in terms of having an impact. If we are promoting particular products, then we are ignoring the value of evidence. And so a lot of what my team does, and we've learned this the hard way, we've just, have we learned this? I mean, we try and avoid it. We've tried to avoid it from experience. Teams come to us and say, I'd love to know about what's the evidence about land reform and land reform in fragile and complex states. And so we'll go away and say, we'll try and be helpful about that. Don't worry, we won't tell you about the product, but we'll come up with something, and we'll try and come up with something that's timely. And what happens is, we do some sort of review, we commission it normally to some of the people in this room, and we'll come back and the policymaker will say, right, thanks, that's really great, I will have a look at that. And then they probably do have a look at it, but what do they do anything about it? It's pretty unclear. Maybe it's informed their knowledge, and that's kind of important. But this goes on to my main lesson, which is, and I'll try and answer some of these questions as well, which is what's critical. We have found in DFID is having some sort of process around whatever product that is, whether systematic reviews or other evidence products for using that evidence. And I'll talk a bit more detail about what I mean by that. But it goes back to this porosity question, the cocoa question, which is that if you get to the stage where you're thinking about how do we disseminate the evidence, so it's like this kind of land reform REA we did, how are we going to disseminate this? It's already going to be quite difficult to do that. We don't get a lot of traction in DFID when we say we're going to disseminate something. Where we get traction is when we are working with a policy team through a process. So we've developed something that we call policy evidence mapping. That sounds more exact than it is, but there's a process that we follow with teams where we are spotting opportunities where DFID feels like it doesn't quite know what the solution is or what the answer is. So it tends to be big things. So like we did this after the war in Syria, big migration crisis, migrants coming across into Europe, and there was this big policy question: what do we do about all these migrants are coming across to Europe, making very dangerous journeys, and a lot of them dying? And so DFID stands up and says, well, okay, we've got a solution to this, because we do the long-term development stuff in places like Lebanon and Jordan, where the Syrian refugees are. But actually, it was a relatively new thing for DFID. We were organised by country. Really, we didn't have a migration policy team. So we, as the Evidence Interaction team, worked directly with the migration policy team in those early days, about understanding what is DFID trying to achieve here. And from that, developed a series of questions. And then, in a sense, the synthesis that's come out of that has been driven by them and not by us. And that is where we have found that we have had greatest success, because we're not trying to disseminate things. They are just using it as part of their daily work. There's just two other quick points that I'd make in response to other questions. That's kind of my general stuff done. But One is I think we should move away from doing systematic reviews where we don't think there's evidence and using them to identify gaps in the evidence, because I think 3IE and others have done brilliant jobs of developing the evidence gap maps, and we can use those. We lose a lot of credibility, we found, internally by doing a systematic review that's empty and doesn't say anything, and we can do that quicker and earlier through evidence gap maps. So I hope we can have an end to empty reviews, with the exception that there are clearly some areas where we might want to look at different types of evidence that sit below the empty review. And then funding streams, there was a question around funding streams. I mean, I don't think that we do actually really separate funding streams and DFID for systematic reviews, other types of synthesis and research communication. I just think that the research communication funding isn't what solves the problem of evidence being used. It's very important, and I think I don't want to underplay the importance of having clear summaries, of having events, of pulling people together. It's critical that people are given a budget for that. But as I said, I think what's much more important is there a process for using that evidence that is driven by policymakers, practitioners.
Thank you. All right, that's fantastic. I guess I'll give Sarah a rebuttal on that one if she wants. I have a question. What is the distinction then between, say, the embedded approach in DFID RPCs, where you have a dedicated research communication engagement uptake process that's mandated and is evaluated at the time the proposal goes in, versus the standalone calls that we're seeing those be cured in 2013. There have been others that have been mooted at various times. Some have become called, some have died quietly without ever getting to tender stage, but they have been separate. And I'm not disagreeing with you, but I would just like to be clear myself about hearing what you said and against that reality.
Yeah, that's a good clarification. So we separate out the production of high quality, rigorous research and the communication of that, and the uptake of that research. So that's one bucket. The second bucket is building the capacity of developing country partners to communicate their research. So I think that latter bucket, certainly the building capacity to use research evidence, is a separate program. Because what we don't want to do is in a scenario where we're saying, okay, well, it's fine for you to take UK taxpayers' money and do slightly rubbish research because you're learning through the process. So we recognise that at the same time we recognise supporting higher education institutions, developing country partner governments to be better at using communicating research as a development intervention in its own right. So that's why we split the two. I would say, leading on to that, as another point I wanted to make, is that I think in DFID we could probably get better at thinking about the sustainability of evidence use. That's partly why I kind of made this point about having a process for using evidence and thinking about that from the outset, is because, and it goes back to Kerry's point really, which is that if all we're doing as the evidence interaction team is commissioning products that we are then sharing very carefully and working with policymakers and asking them about the questions, etc., all we're doing is setting up a scenario where they just come back to us again and then they're not more intelligent customers. So I think so building the sustainability of evidence use, I mean it as in working with people through that process, so they are actually doing bits of it and they are getting better and they understand more what they can ask for and what they can't. And so I think that sustainability of evidence use is critical. And clearly we also try and do that with countries where DFID works, because we recognise that if we want those countries to have thriving research sectors, we need to try and support, if we do fund, the sustainability of communicating high quality evidence.
So I think that's a perfect segue back to one of the remaining points that I asked Mairie to wait, but it come up earlier, which is just a little bit more on the IRC evidence team and how that resonates with what we're hearing around. It's the process, it is engaging with the users. I loved a bit about not just being a help desk, because nobody ever comes back any more intelligent, the next time. But how is that working within the IRC, and what has facilitated it, and where are you seeing the challenges or resistance?
So now I've got the microphone, I will just quickly say, because Mairie might not say it, but if you haven't seen the IRC framework, I would definitely, you have to look at it. It's much better than what DFID does.
Is DFID funded?
No.
You can give partial credit, right?
Yeah, it is all open access, so so people can have a look and play around with the interactive framework. So I think our evidence to action team functions much in the way that DFID does, and the positive things about kind of working with teams right from the beginning, hold true in terms of what makes it a success. So just looking, another example of how we use that team is through developing programs and proposals that we pitch to donors. So for example, we'll work closely with the evidence to action team when we're putting together a new type of multi-sector program, and everyone's got different ideas about what they think works, and we'll work with the team to say, okay, could you just do a rapid synthesized review of what works around these particular interventions. And I guess it comes down to the point that I made earlier, which is it's about the conversation. Then that's the helpful bit. So they go away and do the review, they come back, have a conversation with the team and say, look, this is what we found around the different intervention areas that you asked. And people can ask questions and say, okay, well, does that mean it means this? Or, do we know any more about whether there are outcomes for girls in this particular situation? Really ask questions to the researchers who actually put that together and have a conversation together and understand. And then go away and say, for example, in that situation, there was an intervention that came back that said, there is no rigorous evidence around this. But from the practitioner point of view, they thought that it didn't sit right with them. They thought, well, actually, I've seen this work. I've seen the M&E data around this. I don't want to just throw this off the table just because they've come back and said that there's no evaluation around this. And then it's about working with the team to say, okay, well, yeah, let's look at our theory of change. Let's put something together with the best knowledge that we have, and try and find a way to evaluate it and add to the evidence base around it, and work closely together around that. I think where some of the challenges are, and this is relatively new for the IRC, is exactly the point that's been made, is that how do you build people's capacity around this, where we have the evidence to action team, they obviously have a skill set around this. Practitioners are focused on very, very different sorts of things, right? They want to use the evidence for a purpose. So it's about thinking through what's the best way, what's the best way you can build the capacity of different audiences to actually understand. They don't need to know the details of every single thing. They don't need to know the details of how to put together a systematic review, but they do need to know how to interrogate that properly. And so it's thinking through what information and capacity do people need to know with the limited time they have to be able to understand that. And that's not something that we've, honestly, from my perspective, not something we've thought through. We kind of outsource that to the evidence to action team, and it allows people to not really build their own capacity. And I think that's something that we need to think through more.
Great. Okay, thanks. Kerry, go ahead.
Yeah.
And then I'll...
No,
Get ready to raise your hand.
No, I was just going to say that, reflecting also, we aren't called the Evidence into Action team within UNICEF, but we have a similar mandate. And I think it's just worth reflecting on the fact that, no matter how big the organisation, all of these sorts of teams are always going to be tiny in the grand scheme of things. So it's about how we can use act as a catalyst, I think, a catalytic function to actually get the organisation as a whole to think more, to build an evidence culture, to incentivise people to look and to commission and to use evidence, So some of the things that we've been doing are definitely about practicing what we preach internally in terms of timing. So producing things like gap maps at the time of the new strategic plan, where countries are already thinking about their work plans over the next 4 years, so that they can almost immediately apply and see what some of the gaps are. And this sort of new research management training, as I say. So I think one of the most innovative things that DIFA did was instigating and rolling out critical appraisal skills training for all its technical cadres, and we've blatantly copied that. Just to actually get people to be, intelligent consumers as well as intelligent commissioners, so that it's not always reliant on a tiny team.
Very, thank you.
One quick point. I think that I wanted to share our experience of using the 3IE Commission SOAS systematic review internally to drive a learning process. I don't see dissemination and communication as separate to learning. I think one needs to precede the other. In our world, if you want to have learning opportunities with key stakeholder groups, you have to think in advance of what the best ways are to communicate to that group. So let me use this example of actually explaining that. So when the SOAS systematic review came out, one is that at the level of all our standard systems, we invited SOAS to come and share a draft when the review was actually in progress, so that people understood the methodology. The findings were not done yet. So that's the whole, is the audience intelligent enough to actually grasp what sort of a research effort this is? Once the review is done, then webinars have been a really useful way of actually getting the research team to actually use slides, present key results to groups, and develop a base level of understanding of findings, and then use in-person opportunities to actually build on conversations. So, for example, one of the findings of the SOAS review, which is a finding of many other reviews in the field of certification, is that price is something that really matters in terms of returns to smallholder farmers or certified entities, but often standard systems as interventions do not have control over prices because it's set by international markets. You want to be able to talk to the business community about that. And to be able to drive that conversation, they need a base level of understanding of what this research is, and they're not going to read the summary. So I don't think communication and dissemination are separate to learning. I think we still need to be quite aware of what our audience's ability to grasp, their methodological understanding, their ability to give time is, and then carve out communication in a way that, as very rightly said, fosters learning and a learning process and uptake of evidence, and not communication for communication's sake.
My name is Bruce Mackay. I've been an implementer. I've implemented lots of DFID and some other donor programs, mostly in sexual health, HIV prevention. There's a 3IA summary of systematic review over there on hand washing in it. On page 9 lists implementation factors. Training and qualification of the implementer, coordination between providers of the same intervention, motivation of the implementers, planning skills of the implementers, implementer-related contextual factors, a whole raft of things about the implementer. Now, DFID has a vast volume of, quote, evidence, unquote, in the form of annual reviews, midterm reviews, project completion reviews, of all its projects, going back years and years and years. And in 20 years in this business, I don't think I've ever seen anything from DFID synthesizing the lessons on implementation, because it's there. Most of what has been talked about today and in the form of systematic reviews are about what to do, not how to do it. And how to do it is very messy, it's very, the data is. But you're sitting on top of this amazing story of fairly well-structured information, which covers all those implementation factors that they list here. And I'm asking Nathaniel really, and comments from anybody else about what about the implementation and learning from the implementation?
Hi, I'm Harini. I come from India and I've worked in 2 systematic reviews so far. And I'd like to actually thank you for the question raised, because I'm going to be presenting in the panel in the afternoon on the systematic review that we did, which looks at the life cycle approach in WASH service delivery. And one of the challenges that we faced, it was not rigorous, it was rigorous, but then it wasn't quantitative in that sense, right? Because we were looking at an evaluation, or not an evaluation, but an assessment of different programs implemented by multilateral agencies, bilateral agencies, and NGOs. So the difficulty that we faced was that, be it UNICEF, or, I mean, just naming it because you're just right here, and several other agencies, is that this lack of data on what your program has really done. And when I'm looking at a life cycle approach and how you've targeted different population segments, I find that one is that the information about programmatic information is not catalogued by several organizations, and that again limits the evidence that we're looking for. So when I'm looking for reports, when I'm looking at evaluation reports, and all that, I see very few organizations who've captured this information. That makes it easier for us as researchers to gather evidence on the qualitative aspects of research. Very few organizations seem to have categorized it and has made it available across a 15-year period. So that's one concern that I wanted to sort of flag. And also for several organizations based here to start thinking about how to organize your own information, because there is a lot of value that's available right there. And we always, in the search for evidence, look outside and not necessarily look inward and put out our information more actively. And the second point is, how do we, as a community of researchers, what is our responsibility towards the communities that we're working with? We gather a lot of evidence, but what do we do with this evidence to empower communities that are working in this? It's almost like saying that, I have a partner organization which has done this work, and I will put the responsibility of dissemination on them, and I'm building their capacity. But then, for example, this morning we heard about sexual violence. So my question is, or my reflection on this is, what are we doing to take that research back to the community that we work with? What are we doing to inform the women from whom we've taken these evidences, whom we've interviewed? And what is the responsibility that we owe to that community to say that this is what your community perceives as sexual violence, or the reasons for sexual violence? And not just wait for a top-down approach, where we take it to policymakers, we influence policymakers. We know that influencing policymakers takes a lot of time. So how do we work on this process and change it to a bottom-up approach? Just a couple of reflections on that.
Thank you. Julian Barr from ITEC. It's more of a response than a question. It's a response to Bruce's point about the use of implementation, information, annual reviews and those sorts of things. And I just wanted to sort of point out a couple of sort of more pragmatic approaches than gold standard systematic reviews. And Barry, you mentioned BCure, and we're currently evaluating BCure. And we've done a sort of something between a literature review and a systematic review, but very consciously sort of broadened it to encompass grey literature. And we've used a realist evaluation approach. It's one of the bigger realist evaluations that's going on at the moment. And I think using that context, mechanism, outcome framing of a realist evaluation does allow some of that implementation information to come in. So Bruce, I would just point you at that one. And then Nathaniel, you talked about gap maps, which are more gap than map. And sort of the experience of doing the meta-evaluation of empowerment and accountability for DFID, where the raw material wasn't, the data were stuff that we could get out of DFID that had some sort of evaluative qualities. So we included annual reviews and internal evaluations as valid data for the meta-evaluation. But we struggled even then. We sort of set the net purposely wider than we would with something like a systematic review. But then we still found that it was difficult to get the gold standard to sort of bring in enough of that stuff to give us, in inverted commas, systematic information about what the implementation lessons were and contextual information.
I couldn't agree more with the point that it's the process that matters. But there's the soft side of a process, which is how the relationships and how you're interacting with people and conversations and all that stuff. But also potentially there's a hard side, which is how does the internal processes of the organisation force use of evidence at different stages. And I'd really like to hear what the experiences in DFID or ISEAL or the other organisations about whether they've developed systems around it.
Yeah, Bruce, I'll respond back to your question about implementation. I might just pass over to you, Cameron. Cameron works at DFID as well in a second. So I think I'd say a few things. One is, DFID recognises there's a broader we talk about learning, so we want to get better at learning, and learning isn't just about rigorous evidence, but also learning from our annual reviews, project completion reviews. They are a different type of evidence, though. They are, they might be literally written by the project team, but we want to make sure that we aren't discounting them, and I think it's a fair reflection that we can do a lot more with those. They are sometimes drawn together in lessons across programs, but we could definitely do more of that. And also we don't probably publish that and share it in a way that we do. They tend to be quite internal documents. I'd also say systematic review. We could just do a lot more systematic reviews about how and implementation. There's no reason that we can't do those. I think they just tend not to be done for a variety of reasons, but I think we could do more. And yeah, Julian's point, there's lots of process evaluations about implementation, and I suspect we could also get a lot better at learning from those. Cameron, do you want to?
So I work in the evaluation unit at DFID. Just wanted to very quickly respond to Bruce that we recently, the Policy and Global Programs Cabinet in DFID recently did a complete review of all the annual reviews that we've been doing. And that has resulted in a lot of thinking that is going into how we learn from annual reviews in particular, besides other forms of evidence like evaluations and research studies and statistics in general. And now we're actually planning how to structure that entire process and maybe even teams around it, which entirely focus on the learning that is coming out of annual reviews and then feeding that back into the program delivery process.
Thanks. So responding directly to that question about the not being able to find information, I completely hear you. And I think there are multiple levels. So one is that for some of the most vulnerable and marginalised communities, that data just doesn't even exist. So that's an issue in its own right. And then I think, within UNICEF, we have traditionally, as I say, being more of a sort of doer than a thinker, haven't really had a tradition of publishing. So we're trying to work to actually encourage people to publish externally. There's also issues, I think, of having a sort of a really good information institutional repository. Even internally, we can't find information, let alone external audiences sometimes. And again, I would imagine DFID having had a pretty good database, R4D, which no longer exists, and all has been merged into gov.uk. Equally, as an outsider, finding it very difficult to find some of that information. So it is it's an ongoing challenge. So I think it's getting the data that's missing, documenting it better, actively trying to share it, and sharing those messages more widely. On responsibility to feedback to communities, that's a key part of our quality assurance procedure. It doesn't just relate to generation of research. There's an actual bullet point within that you should, one of the key facets of doing research in a quality assured way is reporting your findings back to communities. And then finally on the implementation science thing, again, completely agree. Within our new strategic plan, particularly coming out of the health concerns, but more broadly as well, much bigger emphasis on system strengthening, operational research, implementation research, if we're talking about scaling up rather than just generating primary data.
So I was going to quickly comment on the implementation piece as well, because the two programs that I'm the director of, we are sharing information about the problems we had with implementing, and I think part of the problem is that there's really limited incentive to talk about, really the best learning is for when things go really badly wrong. So it's what's the incentive to actually share that widely. We make an effort to have those conversations with other practitioners, and that's where we prioritise those conversations, because we're trying to help other people not make the same mistakes that we've made. But it's very difficult to put that out into the public world if people don't understand some of the nuances around why things may or may not have worked. But I think, for the programs that I work on, DFID's been really supportive of helping us kind of get that information out about challenges around implementation. I mean, the other thing around implementation and kind of coming to that point about categorizing is that, I don't know if this is the same in other sectors, but certainly in the field of gender-based violence, we use the same terminology to describe vastly different interventions. And I think a lot of people make assumptions about what, and also because we work on multi-sectoral interventions too, people make assumptions about what those terminologies actually mean. In reality, they could be quite different programs, and I think that causes some confusion at the systematic review level. And then in terms of kind of accountability to the community, different people do this, and I've seen different people do this in different ways, but certainly at the IRC, I think one of the things we do, or one of the things we've been trying to do in the programs that I work in, is work really closely with the country office, but also advocacy groups in the countries that we're working in. So again, thinking through what level of information is right for what type of user. We'll present obviously findings back to the communities that we work with where we can, where communities haven't moved on in a humanitarian context. But where we really see the sustainability is working really closely at the beginning of the project with women's movements and women's groups and the country office, who we know is going to be there for a long time and who we can support to really understand the findings and build those findings into their work plan for the future. So that you have an active civil society in that area, in that region, who can actually take those findings and find them useful for their own advocacy moving forward. And that's a way that we've tried to find, bringing it back to the community and having some accountability.
Vidya, quick comment?
I think on the point of institutionalizing learning processes and the challenge around that, a few examples from our membership where different ideas have worked. So I think the biggest challenge that many of our practitioners face, much like Nathaniel was saying, all managers saying evidence matters, but nothing ever moving up to senior management level, was forcing senior management to create space in meetings and give time to actually absorbing evidence. So monitoring and evaluation teams, sort of working with senior management to make sure that annually or biannually on the agenda was review of state of evidence on particular interventions, and making sure that there is political consensus and will to actually create time for that, which is harder than you think it is to actually get into the agenda of such meetings. I think the second was at more general staff level, transparency and accessibility to information through simple online platforms or portals, whether this is your internal staff level portal or having training sessions on how people can access data and interpret it in a way that it can actually influence their day-to-day operations. So I think transparency information. Some organizations have had data cafes, so once you have completed a particular evaluation cycle, you actually make the data available and bring particular program teams together to actually think of how what trends are they seeing from the data, how do they interpret it, how could it be evaluative. So there's many ideas which I have seen, which organizations have played around with. But I think at the heart of it is a need to create political will to actually make sure that your decision-making process incorporates evidence and mind space to absorb evidence. And I think that's where the form and learning process that we adopt around it could actually make a difference.
I've seen usually happening is that, our whole discourse is about evidence, how it is used, etc., but in the real world, politics, resources, economics, trade, international relations, foreign policy, these are all factors that will bulldoze any evidence that you've got any day. So, I'm also, an evidence person, so to speak. But this is a very important question that I would like to put to the panel, particularly when it comes to systematic reviews, because the notion is that individual impact evaluations focus on smaller issues that are very specific in specific contexts, but systematic reviews answer bigger questions that are much broader and therefore they're more relevant for policymakers, which is not really the case that I see. So there's that final question about, okay, fine, evidence is good, and there are so many different methods, and there are so many different ways of gathering evidence, and then making sure that we use it somehow. But how do you, have you first of all seen these challenges in your work? I'm sure you have. If you have, is there any thinking in your organizations on how to tackle this challenge? The thing that we're doing inside DFID about policy evidence mapping, that works within DFID because we have perhaps the luxury to work with those teams closely for a very long duration, and it's all within the organization. But it might not work if I'm working with an external client or an external.
I'm conscious that we're over time, and that's quite a big question to end on. But shall I try and answer that in response to Ian's question? I'll be very quick. So I think it's about incentives, right? So it's soft incentives and hard incentives, and I absolutely agree that both are critical to overcome some of the challenges you're talking about, Cameron, the politics. I think DFID's actually probably pretty good at the hard incentives, things like forcing people in business cases to look at evidence. I think the real gains are in the softer incentives, because we need to be realistic. Evidence isn't a technocratic answer to all development questions. It's one element which will go in play into diplomacy and things.
Just so you know, the guy with the goat hook was right back there, so we have like 1 minute.
Okay. I mean, just one insight. In our experience, I think decision makers respond to risk much better than they respond to incentives. So the risk of actually not taking evidence into account and the implications of that, if we can find a way to actually use our evidence to communicate that, which is not something we're all, unfortunately it's something we have to do. That's not our job to be doing as researchers or evidence people. But I do think that senior management and business decision makers, COOs, CEOs respond to the language of risk much better than the language of incentive. And if there's a way we can actually build that into the narrative of why using evidence is important, we might have better luck.
I'm convinced that there are a lot of other good comments and questions out there, and I'm sorry that we're out of time, but this has just been a wonderful panel, and I want to thank everyone for all of the wisdom and insights that you've shared. So without further ado, we're going to get booted off.